Well, doctors are calling this a disruptor in the technology of in vitro fertilization. It's called Invocell and effortless IVF. Couples trying to get pregnant are interested in it because of how the procedure is done and a significantly lower cost. A traditional IVF can climb to $17,000 per cycle, while one cycle of Invocell is less than $6,500.
Joining us now with more details is registered nurse and clinical nurse specialist Alice Benjamin. Good morning.
Good morning.
This procedure drew our attention because it was a national story this week. It was about a same-sex couple in which both women carried the same embryo during different stages of pregnancy.
Yes.
So I would imagine that this technique has to involve two women, right?
Well, actually, not necessarily.
Okay.
It just so happens that with this new Invocell IVF process, there are different stages in the process which allowed for both women to participate, which made them both feel more a part of the process, which give them some psychological comfort in it. But no, they didn't do anything extra in the process. It just allowed for both of them to participate.
Okay.
All right, so what is it? What is Invocell and what is this so-called effortless IVF?
Right, so effortless IVF, just as the name implies, is meant to be effortless. It's meant to be easier and less hassle-free for patients who are using this process. And it's similar to traditional IVF in which, a woman needs to take medication to have her eggs harvested. Although with this effortless process, there are less medications, less laboratory tests, less ultrasounds. And so that process is done and then the eggs are harvested. And so there's this small device called the Invocell device. And what happens is once they harvest the eggs, they put the eggs in there, they mix it with sperm, and then they take that device and they actually plant it into the woman's body, into the woman's vagina. And she actually serves as the human incubator compared to what's done in an IVF laboratory.
Okay. FDA approved this gas permeable glass. That was essential for all of this to happen, right? That was a big breakthrough.
Right, so that's the cornerstone of how this works. So when the sperm and the egg are placed into this device, it's gas permeable and it's placed into the woman's vagina, which allows for the most optimal environment. There's a certain amount of carbon dioxide, oxygen, the pH balance, the temperature. And so the contents of the device need to benefit from the woman's environment. So that's why it needed to be gas permeable. And it saves you a lot of money because it's happening within the woman's body compared to an IVF lab where we are trying to mimic these things with highly trained professionals monitoring this, air filter devices, chemicals, temperature management, other machines. So that's really where the cost of IVF comes from. So now with Invocell, this is why the cost is significantly less. We've cut out a lot of the external devices and monitoring by allowing it to happen naturally in a woman's body.
You say the device has to be kept inside the woman's body for 3 to 5 days. Is it uncomfortable? How do they do that?
Well, women who participated in the study didn't report any true discomfort. They did feel that the device was in there, but it wasn't painful, and the device is actually kept in there with what looks like a woman's diaphragm, and it actually serves as kind of a net to allow the device to stay in place for those 3 days prior to us taking it out.
There's some very specific requirements for women and men to get the best results with Invocell. What is that?
Right, so the ideal patients for Invocell are women who are under the age of 37 because usually they have higher quality of eggs, people with a BMI less than 37, who are otherwise healthy and have good ovarian reserve. And then when it comes to men, it's usually men who don't have any sperm issues. So there's no issues with sperm count, motility, or morphology. So it's really for people with unexplained infertility issues.
And so if the doctor says this may be the best option for you, what are the advantages of this, or is it IVF?
Right, so for Invocell therapy, it really is hassle-free. Less blood tests, less sonograms, less medication, less doctor visits, and less cost. So that's the benefit of Invocell, but it's not meant for everyone. So if you are someone who has issues with poor ovarian reserves or there are sperm motility issues, traditional IVF really will be the process for you because it allows for more surveillance and more intervention by the medical team to help you be successful in your fertility pursuit.
Really interesting.
Yeah.
Yes, it is.
Alice Benjamin, emergency room RN and clinical nurse specialist. You can follow her on social media and check out her website, asknursealice.com. Thanks for coming in.
Thank you.